What are the symptoms of early Lyme disease? Well, if you don't remember a rash, one of the classic first descriptions would be migratory arthritis. I have many young children who have presented to pediatricians, for example, traveling to southern France. Father remembered a tick bite himself, got treated for Lyme. The child presents with a migratory arthritis. So the rheumatologist diagnosed him with a reactive arthritis, not infectious arthritis from Lyme, a reactive arthritis, and put him on immunosuppressive agents because his Lyme test was negative. My decision in a case like that would be the father was on holiday with his child. The father had the classic rash. The child did not have the classic rash. The child now has migratory arthritis. The same epidemiology is there. Rather than giving a child a diagnosis of a non-infectious migratory arthritis, I would lean on the side of Lyme disease. The doctors decided not to treat for Lyme because the Lyme test was negative. As stated before, the Lyme test can be negative in 30 to 70% of the cases, depending on the timing of the disease. So multiple different symptoms can be present. Facial palsies, one of the most common causes in the European Union for a facial palsy is Lyme disease. Also, obviously, zoster can cause it. If you're in Africa, the most common cause is HIV. So you have to be aware of the signs and symptoms. Palpitations are quite common. Chest pain is common. Shortness of breath is common. Lyme affects bones, joints, brain, so non-specific finding in the brain, head pressures, migratory pains, brain fog, and as you know, the cranial nerves run out of the brain, so people can get unusual ear symptomatology, eye symptomatology, so multiple different symptoms in multiple different organ systems should be a red light for Lyme. Classically, we think of Lyme meningoencephalitis as a very rare phenomena. These are patients that end up in the hospital with lumbar puncture, but there's a whole spectrum of Lyme neuroborreliosis from just a mild headache. Just like in the summertime, we have people with viral meningitis. A small number of those end up in the hospital, but most of them stay at home. They're counted as viral meningitis, even though they stay at home for a couple of days with a headache. They don't end up in the hospital with lumbar punctures. Similarly, I think there's a whole spectrum of disease with Lyme neuroborreliosis that we're missing. In Ireland, you have to end up in the hospital and get a lumbar puncture. There's specific criteria on your protein and your glucose and your cell count to qualify for a very restrictive diagnosis of Lyme neuroborreliosis. Thus, most cases are not counted.